Well, I actually heard about focal disc when an acquaintance contacted me to help them at a trade show. They said that how there was this new product and explained it to me, and it was like a light bulb went off. Even for adults, anytime you have an incipiency or even a high-risk patient, using a fluoride that will actually get interproximally and not just a fluoride treatment or a varnish, which many people do on high-risk adults or cavity-prone adults, will keep that area stronger so it's not going to get decayed. So it's applicable at any age depending on their caries risk factor. There are even some offices that are using Phocal and placing it after a restoration is placed in a person that has multiple areas of decay to prevent recurrent decay. And that's something that we're really looking into now as another area to use these discs. The easiest way, and the way that I always try first, is to place the disc without using separation. Some adults, there's enough separation even in the posterior teeth to be able to do this. Certainly anterior teeth, you can just use a cotton pliers and place it in. You might have to put a little bit of pressure, use your finger to push it a little bit more. But any of those areas where there's a little bit of space, you can just place the disc in. Using the wedge is, I find, my easiest way. You just put the wedge in between the teeth, push it in a little bit. You might have to wait a few seconds for the teeth to actually start to separate. And then again, just place the focal disc into the area with the cotton pliers, and again, you might have to push it down with your finger. The matrix ring separation is another very easy way to do it, especially on adults. It's simple. You use the tool to open the ring, place it where you want to put the fluoride disc, and once it's stopped, place the fluoride disc from the top into the area that's been created. There is another tool. It's actually like a little piece of metal that goes in between the teeth, and you turn it and then you place the fluoride disc from the side in. We call it the key. The developer of focal discs created his own little tool that separates the teeth. It is something that you have to use two hands for, so you would use that tool and squeeze it so that the teeth are separated, and then use the other hand to place the focal disc in between the teeth. It works really well in some areas. Prior to treatment, all debris and calculus should be removed from the selected areas, and the site should remain dry during placement. Premature wetting softens the discs and can compromise correct interproximal placement. Advise the patient not to eat, drink, or rinse for at least 30 minutes after treatment. If multiple applications are necessary, treat no more than 8 sites at a time and delay subsequent focal applications for at least a day. If deemed necessary, patients may be recalled at intervals of 2 to 12 months for repeated treatments.